You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Thank you so much for joining and listening to the Dental Zone podcast. I'm a dentist with over 30 years experience and I've been working holistically since 2001. I have my own dental practice called Evolve Dental in Brisbane. And this show is a place I like to share my years of knowledge and expertise when it comes to dental health and your overall well-being, what holistic dentistry is, and the impact that your mouth has on the rest of your body and vice versa. To find out more, you can hop on over to holisticdentistry.au. But for now, let's get in the zone. So I've been doing a whole series on amalgam and mercury and amalgam removal, and I thought let's have a little bit of a change this week. I'm going to talk about fluoride, and tonight's topic is Fluoride Uncensored. So I'm talking about how there's a lot of science behind fluoride. You know, what are the pros and cons? Does it really prevent tooth decay? And should we be drinking it? And what is it doing when we are? So I'm going to expose some of these topics. Tonight, it's about fluoride and Fluoride Uncensored. So I'm going to give you a little, there may be Dr. Rachel going off on a bit of a fluoride rant, but, you know, that's what it's all about. I've got some notes so that I've got my facts and my statistics straight for you, and I hope that you'll find this very enjoyable and informative. Really, I want to start with how much fluoride is safe and how much fluoride is bad. You know, is fluoride bad for you? And if so, how much? Well, look, most conventionally trained dentists are not going to have this conversation with you because what we're taught is that you drink the fluoride as your teeth are growing and developing, it makes your enamel harder and therefore you're less likely to get tooth decay. Well, if this is the case, why are we making everybody drink it? Because once you're over 7 or 8 years old, the enamel on the majority of your teeth, other than your wisdom teeth, is already formed. So when you're drinking it, where's it going if it's not going to your teeth? The other question I have is why are we drinking it when research is showing that the main benefit from fluoride, if you're going to use it and you want to use it, is through topical application. And that means putting it directly onto the surface of the tooth. So here's your tooth, you paint the fluoride on, do that with the toothpaste, the mouthwash or varnishes and gels. I don't think there's any need to drink it. So there is a lot of science behind fluoride and its impact on your teeth and your health. But have you been told both sides of the coin? And have you been told the truth about fluoride? And look, there's going to be arguments about fluoridation and whether it causes detectable harm. Because really, you know, oh, it's such a tiny amount in the water supply. So what's the fuss? Well, how much fluoride is safe? Well, the answer is 0. You know, just like arsenic, lead, and mercury, fluoride is actually a poisoning. It's a poison. It doesn't do anything but poison us. That's why it reduces tooth decay. When you have germs on your teeth and you put fluoride directly on them, it poisons them, they get sick, and they can't produce acid like they did before. And it's that acid production that weakens the enamel, allows the bacteria inside your teeth. So my question is, if there's 0 safe level for fluoride, should you be drinking it? Should you be exposing yourself to it? My other question is a little bit like if I don't want to get sunburnt, do I drink sun cream? No, I don't. I put it directly on my skin. I put it on my arms and I put it on my face. I don't drink it and hope that it's going to stop the sun affecting my body. So why are we drinking fluoride? You have to ask yourself, should we be drinking it and should we be using it at all if it's a poison? Well, there's these arguments that said it's all dose dependent. So, you know, some things are only a poison if you drink them in certain amounts or ingest them in certain amounts. So is this why we can get away with it? But if it's a deadly poison, and it has its uses in chemistry, and fluoride is a very, very valuable chemical material. But should we be putting it in the human body? Should we be putting it in the water supply and exposing, mass medicating, in inverted commas, because they won't admit that it's a medication, because if they do, then it needs controls. Should we be putting that in the water supply? I don't know. Let's find out. So I'm going to talk a little bit about fluoride exposure. So we are exposed every day to levels of fluoride. If you live in a fluoridated area in particular, you're going to be exposed to levels of fluoride that are known to harm man. They're going to harm your body. Okay, so you go, well, I don't live in a fluoridated area. I, have purified water that has no fluoride in it. But most of the food and drink that we buy and we consume is made with tap water. And that tap water usually contains fluoride. They even do special bottles of water. I've seen these when I've been traveling in the US, and it says enhanced with fluoride. And this is targeted towards children. Commercial food has fluoride in it, so you can't get a shortage of exposure to this poison. Water fluoridation. So the fluoride that they put in the water supply is not a pure product. It is not sodium fluoride and nothing else. It's actually a hazardous waste product from industry, so from the fertilizer and aluminium industry. It's not pure. It has toxins in it. We buy fluoride from China because it's illegal in China to put fluoride in the water supply. So we buy it from them and we stick it in the water. And China was buying all our recycling materials up until quite recently. So I wonder if that's the kind of deal that we had going on. I don't know. Just my theory. So what level of fluoride exposure is considered safe? Well, accordingly to the Environmental Protection Agency in the United States, the EPA, they said that 4 parts per million of fluoride was safe. And the American Dental Association was saying 8 parts per million. Well, in 2006, the National Academy of Science voted unanimously. That means everybody said that 4 parts per million was not safe. But this stuff is allowed to be added to the drinking water because due to the EPA rules, the Food and Drugs Administration or the Therapeutic Goods Agency here in Australia do not regulate food and water. It's a free-for-all. They don't have to go through clinical trials. They don't have to have evidence-based science. They don't have to make sure that there's no harm. They don't have to go through this whole process of proving that this stuff is okay. So I'm going to talk a bit now about fluoride poisoning. Now, if you were to ingest 5 milligrams of fluoride per kilo of body weight, this will kill you. Yet we're being regularly exposed to doses of fluoride that are supposed to be safe on a daily basis. There's a whole industry set up around selling you fluoride toothpaste, fluoride mouthwash, fluoride gels, and products that you can apply to your teeth. Dentists, we have our reputation at stake because we're taught at dental schools fluoride's safe, it prevents dental decay, and we just parrot back and regurgitate what we've been told, even though we can't actually prove it scientifically. It doesn't stack up. The fluoride policy in the US has been taken to court. And when it comes to death rates from fluoride, they've lost 3 times. The courts say this stuff is hazardous, you should not be using it. But they win on politics because of the huge lobbying power from certain groups. So we need to use science to make our decisions on what is safe and what is good for our health, not political pressure from a lobby group who are funded by industries that have a lot to gain by putting fluoride in your water. Fluoride waste from industry is going into our water supply, and we are being sold that this is good for us And we're doing it to help the children, prevent decay, and, the poor children, the pain and suffering, and we fall for this. So let's look at some numbers. So hang on a minute. Let me just get these numbers up. I want to make sure I'm telling you the right thing. Adding fluoride waste from industry with all its contaminants adds 14 parts per billion of lead to the water. But that's okay. We can have up to 15 parts per billion before it's considered harmful. Well, hello. I don't want any lead in my water supply. Isn't the fact that we remove lead from petrol and paint because it's harmful to health, it lowers IQ and it causes damage to the body? Why are we saying it's okay to have just below the toxic load in our water supply? Now, your water supply from the town or the municipal water, that's fine for doing your laundry. It's okay for flushing the toilet, great for washing your car. But should we be drinking it? Not with those level of contaminants, not with that level of lead and fluoride and other bits and pieces in it. You simply can't, if you live in a fluoridated area, get water from the tap that is safe for everyone to consume. That is my opinion, and not just my opinion, but it's also science. So let's look at what we're being told. We're looking at a single dose of fluoride versus a combination dose. So if you were just to have a one-off single dose at the levels that are quoted as safe on its own, pure, not in combination with any other toxins and not over a repeated exposure or prolonged exposure, then you would say, okay, that's all right, it's a one-off, it's not going to kill you. But the problem is it's not a one-off. We're ingesting it over and over. It's in the water, it's in our food, it's in medications, it's in our food chain, and we are being exposed to this. So every time you consume it, fluoride gets stored in your body and it builds up. It builds up over time. This is a process called bioaccumulation. So it's not a one-off dose. It's a multiple repeated dose that's having an impact. Now, excessive fluoride can affect your brain function. Just like lead, it lowers IQ in children. It's a toxic element. It is a neurotoxin. That means it damages your nerves and your brain. It's in medications like Prozac, but here science will argue it's okay, it's not metabolized, it doesn't show up. But it does. It shows up in your urine, which means it's actually going into your body before your body can excrete some of it. So some of it's getting stored and some of it's going out. So let's look at fluoride and dentistry. I'm just going to take a breath because I can feel rants coming on. Dentists are using high concentrated time-release fluoride fillings. They're using varnishes that they will place on the tooth and that will release fluoride over time. This means that you, the person whose mouth that they're in, is also getting exposed to fluoride over time as well. Fluoride accumulates in our bones. This is where you get some of the earliest symptoms happening, like broken bones, joint pain. And nowadays, if you look at the statistics, kids break their bones more often than they did 50 years ago. And there's a hypothesis that this is because the bones are weaker due to higher levels of fluoride. Now, if you live in a fluoridated area, your bone level of fluoride is nearly to the first level of poisoning and above, just from drinking it. Now, it's interesting that, we're saying we're giving you fluoride to prevent dental problems, but one of the issues that fluoride seems to create is crooked and crowding teeth. Now, in experiments, if you give animals fluoride during development, their teeth crowd. Is this why more and more kids are needing orthodontics and braces? Is this why they're showing developmental problems in the shape of their jaws, where their bite is out and their airway is compromised? Could it be? There haven't been enough studies, but there has been enough to show that it does have an impact. One of the interesting studies that they'll use is that they'll show different demographics that'll say, okay, we took a group of children here in a fluoridated area, and we took a group of children the same age in a non-fluoridated area, and we can say they got less tooth decay. But what happens is fluoride actually in the bone delays the eruption of the adult teeth. So it's not stopping tooth decay, it's actually just slowing it down and delaying it because the teeth aren't there. So what happens is the adult tooth can't get through the baby tooth. And so the adult tooth will just go, well, I'll go over here. It's easier. I'll go to the side and get around the baby tooth because the fluoride is altering the chemical structures of the teeth. There's a lot of consequences of drinking this stuff. Where does this fluoride come from? I touched on this earlier. We are importing hazardous waste from China, Mexico, and Japan and putting it in our water supplies at great expense, supposedly as, what we're going to say, this is a medication that has never been tested and has never been approved. We've got health problems going through the roof. We've got poor diet, and we're being exposed to toxins. And one of the ironic things is we're being exposed to toxins in the name of oral health. This is our great oral health program. It's going to stop decay once and for all. We have been fluoridating since the 1950s, yet we are still seeing tooth decay. Something clearly is not working here. So how did it end up in our drinking water to begin with? Well, industries needed to get rid of this hazardous waste. It's a byproduct of aluminium, fertilizer, I think it's concrete as well. So the story about fluoride and dental health was invented, and I'm going to say that I believe it was a lie that is now being taught to our dentists, who then regurgitate it because they believe it's true. And I'm not having a go at dentists because I love my profession dearly, but we want to make a difference. We want to help people. We want to prevent decay. We don't want to see kiddies going off for general anaesthetics and having baby teeth removed. We don't want to see people with abscesses and pain and suffering. So we swallow this lie, hook, line, and sinker, because we believe it's going to make a difference. Yet it's this tiny, tiny little piece of the puzzle. We are not taught about nutrition. We are not taught about systemic health and impacts on our tooth development and resistance to tooth decay. We're taught brush, floss, don't eat sugar and have fluoride, but it's not working, guys. We need to go back and start again. So if our dentists are not being properly trained and educated about fluoride, then how can we be experts? How can dentists be experts to recommend fluoride when we're not being given all the information, that we're not being trained properly? This is essentially a furphy, a mistruth, a lie, let's call it what it is, coming from government agencies originally so that they could dispose of that fluoride from industrial waste. They could get rid of the byproduct from phosphate fertiliser and gypsum, plaster of Paris, that's why I was thinking concrete, sorry guys, and aluminium. You can imagine you've got all this byproducts. You can't dump it, you can't dispose it, it's going to cost you a lot of money to get rid of it. If you could just tip it into the water supply, great solution. So when you add fluoride to the water supply, there's in that population, there's been shown to be a 10% increase in death cancer rates. Now, I'm not saying that the fluoride is causing cancer, but the number of people who die from cancer goes up in communities that are fluoridated. Now, is that because our bodies are getting messed up? Are our immune systems compromised? Are we not able to deal with the level of toxins? Government, there's been studies that just show this, and government agencies overthrow the research and the toxicology. It's just crazy. And so we still have fluoride very heavily in the United States, areas of the UK, areas here in Australia, and we're pushing to introduce fluoridation into parts of Australia that don't have it, when in Europe, they're actually stopping fluoride. So many areas of Europe do not fluoridate, A, because of the concerns to health, and B, because those areas that did have it, it was so expensive to do and it just wasn't making enough difference. So why are we here in Australia wanting to fluoridate where everywhere else is saying, no, let's stop? Okay. Another concern is that if a baby is being bottle fed, what happens in the mother is that breast milk will naturally filter out any fluoride. I don't know how the body does it. It's genius. But there's a very, 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 very low level of fluoride in breast milk. Yet if we're bottle feeding a baby on fluoridated water, they're getting 4 to 5 times the recommended safe dose, the so-called safe dose of fluoride. And this has been shown to harm the thyroid, brain function. And we used to call this cretinism, because it lowers the IQ. So we don't want toxic food. So we don't want industry to tell us what's in it. They just say everything's healthy, it's all good, it's just water. It's all perception that everything's okay and healthy. And this is also with fluoride. And, people say to me, oh, well, they wouldn't recommend it if it wasn't good for you. I'm like, come on, we've got to open our eyes and we've got to look at the research and we've got to look at the toxicology here. When it comes to fluoride, we are hell-bent on being told that it's healthy, it's going to prevent tooth decay, that it's not a poison, that it's not toxic. Fluoride's in rat poison, guys. We can say it's a small dose, but it's accumulating. It's an ongoing effect. In the USA, toothpaste comes with a poisons warning. It comes with warning signs not to swallow it, and you're told if your child does swallow a significant amount of toothpaste, you need to call the Poisons Control Centre and go to the hospital. A half pea size, little green pea, a half pea size amount has 1 microgram of fluoride in it. Children can't spit. They can't spit out properly. So if you're putting tons of toothpaste on their brush, or they're doing, or as I used to when I was a kid, I liked the minty taste, so I just eat the stuff. I used to say, look, if I didn't grow up in a fluoridated area and eat toothpaste, that my IQ would have been up there with Einstein. But anyway, I digress. Children can't spit out the toothpaste. So the more you put on the toothbrush, the more of it they're swallowing. Fluoride enters the bloodstream very, very quickly because your body wants to get rid of it. It wants it to get it out and pass it out through your kidneys. What happens is because of this, half the fluoride is gone in a few hours and the other bit gets stuck in your bones for the rest of your life. It's just there. It becomes part of your bone system. Fluoride is stored in your bones, and as you get older, you start losing your bone. They start to deteriorate. And so with aging, this fluoride becomes released out of the bones. So one day you hit a threshold of toxicity where your body can no longer deal with a toxin and you start to notice symptoms. But the toxicity had always been there and it was weakening your body before you hit this threshold level. So would it make sense to minimize your exposure way before that, as harm starts the moment you're ingested? It would make sense to me not to ingest fluoride or expose yourself to it at all. So when it comes to fluoride, I'm going to say we need to stop making it about teeth. We need to stop making it about kidneys and dental decay. We need to make it about full body health. We need to take a holistic approach and look at this as what it's doing us to a body as a whole and not just to a part of the body in isolation. Fluoride impacts your health. It impacts your thyroid, your endocrine system, your nervous system, your bone health, and so on. Toxicology has shown this. The dental associations keep pushing fluoride, and dentists just follow suit. We promote it, not we as me, but dentistry. They promote it, they give away free samples. The toothpaste companies come in and give you these samples, and then you're supposed to pass it on to your patients. None of the toothpaste reps come to my practice because they know the answer is going to be, does it have fluoride in? No, thank you, we don't want it. Countries in Europe, except Ireland, and 60% of the UK, do not fluoridate their water. I'm going to say it again. Everywhere in Europe except Ireland and 60% of the UK do not fluoridate. The majority never did, or they started to and then they stopped. I know in New Zealand, this is a really hotly debated topic, as it is here in Australia, where for probably the past 10 years, maybe more, there has been a big push to add fluoride to the water supply. My question is, why? Why are we wanting to do this when science says it is not beneficial to health? It does not significantly reduce tooth decay. We need to be addressing sugar intake, soft drink intake, and poor nutrition. And unfortunately, food that is good, natural, and healthy is more expensive than junk food. And if you're from a poor socioeconomic area, you are not supported to eat well and eat healthy. I think we would be better spending the money that we spend on fluoridation and lobbying to reduce the cost of good, decent food and make it affordable across the board. It's an interesting study in Germany. So after the Second World War, Germany was split east and west. The east had fluoride, the west did not. And you know what's ironic? The east had less tooth decay once the fluoride got removed from the water. The epidemiological studies showed that fluoride in the water was not helping them one bit, not at all when it came to tooth decay. Now, Ireland is fluoridated. Ireland has some of the worst teeth in fluoride in Europe, despite having the most fluoride. It doesn't make sense. This does not add up. If fluoride prevents tooth decay, why are areas that are fluoridated showing the worst teeth? It makes no sense, none whatsoever. So as I said earlier, if you put fluoridated water in baby formula, you're going to give them way over the safe exposure limit. I've got some ethical questions. How come we can medically treat a mass population without informed consent? I can't prescribe you treatment, medications, antibiotics without saying to you, this is what it is, this is what it does, these are the possible side effects, these are the benefits, and get your consent for you to have the treatment or take the medication. Why can we mass medicate communities without consent? Why can we mass medicate without it being prescribed by a medical doctor for an individual and for their individual condition? To me, this is completely unethical. It is an authoritarian approach to healthcare. It is saying, we know better than you, we know what you need, we're going to tell you what to do, and this will be in your water because you don't know what's good for you and we do. You don't know me. You don't know my health history. You don't know my body. You don't know how I eat. You don't know my lifestyle. You know nothing about me, yet you are enforcing a medication on me by putting it in the water supply. That's just so wrong. Other people should not get to make our healthcare choices for us. It's unethical. It's undemocratic. But what if we challenged our politicians? What if we said, hey, politicians, medical doctors and dentists, I just want to ask some questions. We don't have to get aggressive and all head up, even though sometimes it makes us feel that way and we can be quite angry. But just ask, is this right? Where's the data? Can you show me the information that says this is okay, that it is safe, that it is effective? Can you show me where the clinical trials are? By doing this, we're going to start making people think. They're going to overcome their ignorance and perhaps some of the arrogance of the we know best attitude, and you would be free to make your own decisions for your own body. You are entitled to know what the side effects are of you ingesting something could be and what the possible outcomes to your health might be as well. So I don't want you to just take my word for it. I want you to do your own investigating. I just simply want you to inform yourself. Personally, if something is going to threaten my health, I'm going to stay away from it. So I'm going to say to you, if something's going to threaten your health, would you want to stay away from it? If you don't need to take it, you're not going to die without fluoride. It's not an essential ingredient for your body. Then don't take it. Stay away from it. You have a choice. You can make a lifestyle change. You can improve your health. You can you can change your diet. You can do some work, and you can make a change so you can manage your own health. So when it comes to fluoride, I'm going to ask you to educate yourself, empower yourself. You might say, that woman's a lunatic. She's talking nonsense. That's fine. It's not personal. If you don't like what I have to say, you don't have to tune in. I want you to Google or go on YouTube and look up Fluoride Gate, the movie by David Kennedy, who is a dentist. He may have retired now, I think, but he's a dentist and a toxicologist. So he's kind of on both sides of the coin where he's had the information. It is a great movie, contains some wonderful information. Go do some reading, do some research, find out for yourself. This is Fluoride Uncensored, so I haven't held back as much as I normally would tonight. I was just wondering if I had a couple of little facts here that I wanted to tell you about, or whether it's disappeared off my screen. So essentially, fluoride's a poison. I'm going to ask you not to ingest it unless you want to do so, but it shouldn't be in the water. I don't think that's fair. It takes away freedom of choice. And then if you want to not have the water, you've got to go buy bottled water, or you've got to get filters to get rid of it. And, that's an expense to people. I personally believe if people want to have fluoride, then they should have the chance to obtain fluoride tablets or fluoride drops and ingest it that way. And then that's their own choice. So I just wondered if I had something here that I wanted to explain to you. One of the major effects of fluoride exposure is that it affects your endocrine function. It changes, it varies for individuals. It's an endocrine disruptor. It affects your endocrine function, and it's, mimicking normal hormones. So it affects your thyroid function. It elevates thyroid stimulating hormone. It alters the concentration of T3 and T4. It increases, hyperparathyroidism. It has impaired glucose intolerance. It has possible effects on sexual maturity. There is so much information, and a lot of this comes from America's National Research Council in Washington, D.C., from their own report and their own paper, where they are saying this stuff is a toxin. It's a bone toxin, it's an endocrine toxin, and it's a neurotoxin. So I have to strongly question, why are we fluoridating our water supply? Why are we pushing for this? Do give us some likes and some shares. Get this out there, because, it's very rare for us dentists. And there's a lot of us who feel this way. It's not just me. I'm just more vocal. There's a lot of us who feel this way, and I think it's important that we help people find this information so that they can educate and make choices. If you're listening to this on something like Apple Podcasts, then please rate and give us a review. And as I said earlier, do share the podcasts. Do talk to other people about it. If you think that this information is worth listening to, then get it out there so that other people can come across it. Thank you so much for listening. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. This is the Dental Zone podcast, and this has been Fluoride Uncensored. If you're looking for an holistic dentist, then you can call my clinic on 0737 20 1811 and book in for a consultation, or email us info@holisticdentistry.au. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.